Welcome to this presentation of the 2017 Organizational Change Process at Northeast Georgia Medical Center. Northeast Georgia Medical Center is a not-for-profit organization with 3 campuses: Gainesville, Brazelton, and Barrow. The organization's mission is to improve the health of the community in all that they do. Several factors contributed to the decision to change documentation applications. After 2.5 years of using the McKesson Paragon product, Epic was selected as the new electronic medical record system. What are the reasons for these changes? They include several factors identified by the clinical and administrative staff. Collaboratively, the decision was made after observing failures in proper health information exchange, non-compliance with mandatory documentation by the clinical staff, chart audit ineffectiveness, and a lack of intuitive usability with the McKesson product. Carol Burrell is the president and CEO of the administrative team at Northeast Georgia Medical Center. Northeast Georgia Medical Center provides several services to the community. They include hospital healthcare services, medical offices, urgent care centers, rehabilitation, long-term care, sleep centers, mental health and substance abuse centers, as well as a satellite cancer center. Additionally, in-home services include hospice and Lifeline for emergency response. Northeast Georgia Medical Center has other services that it provides to the community, and they include a university-based nursing residency program and a graduate medical residency program. These were established to serve the community and to contribute to the patient's care. By making a difference in the life of each patient, due to the culture of continuous improvement, consistent growth, cutting-edge technology, and breakthrough ideas. to keep the staff updated on the EPIC change process. Several communication plans and strategies were utilized. They included committee meetings, staff training and train-the-trainer sessions, McKesson Paragon Legacy Group creation, email communications, departmental daily huddles, auditorium-based presentations, and monthly newsletters. Transition issues developed as it related to new hire staff. These included the nursing staff, travel nurses, and the nurses in the residency program, as well as physicians and providers. In terms of training concerns, there were inadequate classroom accommodations, as well as software and hardware challenges. The technical team did experience e-learning design challenges due to communication failures. These failures were a result of information provided by the clinical training team that needed to be clarified. They were inadequate and resulted in improper module creations and do-overs. Frustrations further developed as a result of delayed communication responses to sought clarifications. Additionally, non-clinical team members contributed to the communication failures. Effective management interventions did facilitate resolutions and ensured timely deliverables. Solution for these change process challenges included departmental team brainstorming sessions, adapting and being flexible to the start date for providers and new hires, technical team hiring more support staff, and additional classrooms were created. Though the Northeast Georgia Medical Center staff had little to no resistance to this EPIC implementation, it is important to note that there are many stakeholders who can show resistance during a change process. There are both internal stakeholders as well as external stakeholders, and this can impact the success of any change process. In evaluating the change process at Northeast Georgia Medical Center, it was quite successful despite the e-learning design challenges and the EPIC classroom training issues. Successful projects comply with the scope, time, and cost as intended, and in this way they were in fact successful. In conclusion, Northeast Georgia Medical Center reports successful EPIC activation and based these findings on feedback from the organizational team members. Intuitive software usability. Include intuitive software usability that went very well, clinical staff adoption, effective and efficient chart auditing, central point computer software updates, health information exchange data sharing, train-the-trainer cost containment. When this also concludes my presentation on the EPIC project change process at Northeast Georgia Medical Center. Thank you for attending.